webinar. This is the first of its kind. I am Brett Newcomb, your host, and this is Dr. Kathy Maupin, who is the medical director of Bioidentical Health here in St. Louis, Missouri, and we are the co-authors of The Secret Female Hormone, How Testosterone Can Change Your Life. And we also are the co-host of the weekly Biobalance Healthcast that has over 180 episodes out on YouTube and on the web that you can find, and hopefully some of you are familiar with those. We are holding this webinar today because in the course of all the different things that we do, we have been getting a lot of questions that people needed the answers to, and so we thought we would do this and invite you to participate, and you can participate live. If you will look at the left-hand side of your screen, there should be a small square button that has a QA on it. If you will click that, then you'll get a band on the right-hand side of your screen that will allow you to type a question and send it to us, and we will take it live on air. Those of you that registered early sent us some questions on your own. We'll try to work through those as well. So while we wait on this process to warm up and see what your live questions are, we will begin to go through some of the questions that we have already received. And Kathy, the first question that we received was from Cindy, and Cindy wants to know, why is it more difficult to have an orgasm after menopause? And by the way, she says she is on bioidenticals, but she doesn't say what kind.
Okay, well, orgasms depend on both testosterone and the testosterone level, and oxytocin, which is another hormone from the brain. It's the same hormone that causes milk letdown in women who are breastfeeding, but it also helps us with orgasms. Both of those hormones decrease even before menopause. So testosterone in general stimulates oxytocin. Oxytocin is needed for a good orgasm. So what I would say is maybe your bioidenticals don't have any testosterone in them, or maybe they don't have enough, because you should be able to stimulate your oxytocin with the testosterone.
Okay. And we have our first live question. The question is, how should I talk to my doctor about testosterone? What type of test should I take, or testosterone should I take? I am 47. I had a complete hysterectomy 4 weeks ago.
Well, you're in the best group and the easiest group to talk a doctor into giving you testosterone, because you definitely are going to need estrogen unless you've had breast cancer. And so what I would say is, I understand that I've read this book, or I've watched Dr. Maupin on podcasts, and I would like to have testosterone to solve my symptoms of testosterone deficiency. Is it possible for you to give me testosterone? And if not, then see if he can refer you to someone who specializes in giving postmenopausal hormones.
Well, at the risk of self-aggrandizement, we would recommend you get a copy of our book and go through it. There are checklists there for symptoms. You certainly can look at that and then talk specifically to your doctor about that. But you can also take the book to your doctor and say, are you familiar with this? Do you do this kind of treatment? Do you know somebody that does? Because I feel like I need these.
We put reference articles in there. There are many pages of the journals, the medical journals, that we got all of our information from and gathered from many different specialties and brought to that book. So that would speak to your doctor even more than just reading the book. But just for your information, yes, there are lots of articles that defend this position, many, hundreds, thousands. I've got binders full. So
binders full. Patricia writes to us that she is concerned about getting coverage from her insurance company. She said insurance doesn't cover this, and she's enraged and outraged because it doesn't, because it seems to be such an obvious and necessary thing for aging women. What can she do?
Well, insurance, insurance. Insurance will pay for only what it has to, and since the FDA has not approved bioidentical hormones in any type, in any form for women, or testosterone for women, then the insurance companies take that as an opportunity to save money and not provide it to us. But it is really discriminatory, because they do allow bioidentical hormones for men, and they do pay for it. So I would say every time, if you do pay for them yourselves, take your receipts and take your HCFA forms that your doctor should be able to give you. As you pay the doctor, you take those forms and you send them to your insurance company and scream discrimination. I mean, that's the only thing I can tell you.
And then you file an appeal.
Yeah, but some people have been noisy enough to get it paid for.
Right, some do. But you file an appeal saying this is sexual discrimination because they do pay for men.
Yeah, but I'm just afraid that they won't cover men anymore, but they should. They cover men for all other types of testosterone.
Right. We have a similar question from Kelly and from Janice, wanting to know about why you choose pellet therapy over creams or tabs or other delivery mechanisms for testosterone.
Well, pellets give you the same level of hormone and the, testosterone especially, and estrogen, that bring all of your hormones back to premenopausal levels. And it's impossible to do that with any other form. So that actually makes you feel much more normal. And it also, I mean, I tried all those other forms before. I tried pellets, and I know what not feeling like yourself feels like. And when I got the pellets, I felt just like my old self. So that's an emotional description, but the facts are that your hormones and all of the stimulatory hormones that caused your ovaries to make these hormones, like estrogen, testosterone, and sometimes progesterone, those actually, we bring them back to normal with pellets, but we can't bring them all back to normal. Like FSH and LH, they never drop down to what you were before menopause. So that's one good reason. And then they deliver your hormones directly to your bloodstream, so they don't have to traverse the skin or the vagina or the cheek. And in that tiny little jump into the bloodstream from the different skin or mucosal layers, then that they change and they make lots of estrogen. So they don't give you exactly the hormones that were prescribed. It changes a little bit in that trip through the skin into the capillaries. So testosterone is in the fat. The pellets are in the fat, and the estrogen as well, and they dissolve and they're picked up by capillaries right away, just as if your ovary was secreting them.
Yeah, so your body metabolizes things automatically. I mean, if something new is put into your body, it begins to break it down. And with the creams or the tabs, that breakdown process begins to change the structure of it. But with the pellets, that's pure testosterone or pure estrogen that's put in the fat tissue, and it remains there until the body starts to break it down, and it's not converted through something else first. It's
not dose dependent. Every day, if you take something once a day, it goes up and down every day. But the pellets go up and they stay up until they run out, and then we have to redose. But that's like a 4-month to a 6-month window of feeling essentially the same every day.
Yes.
Not always.
Laurie wants to know if HRT, and I assume by that she means testosterone as well as other forms, is safe for a diabetic.
Yeah, actually we have many diabetics and pre-diabetics. Actually, testosterone improves insulin resistance, which is, for a diabetic, you have to take insulin, and you over time you have to increase your dose because you become more and more resistant to insulin. And insulin is what carries blood sugar into your cells so you can make energy. So what happens is, as they increase their insulin level, they actually then deposit more fat. So they make the problem worse over time. Testosterone reverses that. Testosterone actually makes people more insulin sensitive. So it's one of the ways that we can get weight loss in diabetics, and we can have them much healthier because their tissues, their muscles are building, and they're working better. They're burning calories. They lose weight. Pre-diabetics, we can have somebody who has insulin resistance and low blood sugar. We can pull them away from the edge of the cliff of diabetes by putting them on testosterone, making more muscle, losing fat. They of course have to be on a good low-carb diet and exercising somewhat, but they lose weight and they're no longer diabetics.
Great.
Or pre-diabetics.
We have a live question from Lorraine, who is in the United Kingdom watching our show. So welcome, Lorraine.
Hi, Lorraine.
Now, her question is, and she uses some abbreviation, so you have to help me
I'll look over
make
your
sure
shoulder.
I get those. I have been on 50 milligrams of estrogen patches and a half milligram estrogen to raise my SHBG, as well as it was at level 1, and Estradiol was 63 4 weeks ago. I am booked in to have testosterone pellets tomorrow. Will testosterone cause problems if my SHBG is not even high?
That's actually a really good question, but this should make you feel a lot better, and that is that testosterone drops your sex hormone binding globulin. So if you don't know what this is, and I'm sure most people don't, testosterone and estrogen are both bound and inactivated by this protein from the liver. So SHBG inactivates both hormones. So I don't like people to have a high SHBG because I give them testosterone or estrogen and it binds it up and you can't use it. So it makes it inactive. So I'd like your SHBG to be somewhat low. And giving more and more estrogen makes it higher. Testosterone will drop the SHBG, and you'll feel your testosterone more. I would not try to get my SHBG up. I would just take your estrogen at the level that gets rid of your symptoms, and 60 is a normal. Is 64?
63 4 weeks ago.
Okay, was 63, which is fine. Normal is 60 to 250 in people who are premenopausal. So that's a good level.
Mm-hmm.
So I wouldn't go any higher than that, but the testosterone pellets actually will work better if the SHBG is lower, and it will help lower it. So we'd like to know from you, just so that we know who you're going to in England, because we're looking for places to send our patients in England. So if you could just give us that by email, we would appreciate that.
Yes, and you can reach us by email at biobalancehealth.com or at drkathymaupin.com. We monitor both of those, and we'll get your email privately and respond to you, and appreciate that. Thank you for your question. Joan has a question. She is a 57-year-old female, and her doctor put her on progesterone for sleep. Says she's been diagnosed with sleep apnea, and she has no desire for sex. She's wondering if her testosterone levels might be low. Ever since menopause, she can't sleep. And she wants to know if testosterone would help her sleep and help her get her sex drive back.
Okay, so first the progesterone. Your doctor put you on progesterone to relax you. So that's why I always dose progesterone at night. I never give people progesterone in the morning because it makes them too tired. They don't feel like going to work or doing whatever they have to do around the house. So progesterone's a nighttime hormone for the highest part of the dose. So I do that at night. That does relax people, but it doesn't keep them asleep. So testosterone is really the sleep hormone. For you to get into the deep sleep, into REM sleep, and for you to have a lot of dreams and actually be refreshed in the morning, you need testosterone. So your testosterone probably is low, and that would be necessary to be checked. It will probably have to be replaced. You can stay on progesterone especially if you're taking estrogen. There's nothing wrong with doing that as long as it's not a progestin, not a synthetic progesterone, but a pure one or a compounded one. That's fine. But sleep apnea usually happens after menopause, secondary to gaining weight. So the testosterone will help you build muscle and lose fat, which will help your neck, which will help you with most forms of sleep apnea.
Okay. We are live, and you can send us questions live. If you look at the left-hand side of your screen, there should be a button that has a QA on it. If you'll click that, it'll open a band on the right-hand side of your screen where you can type and send us a question, and we'll be happy to respond to those, as many of those as we can, on the air. And we have another question from Anna, who writes, can a case of severe mono cause hormone deficiency in a 33-year-old female?
Mono generally doesn't suppress the ovaries. It usually works on the immune system. So it makes you feel so tired that you may not have a sex drive. But birth control pills also decrease sex drive. There's several other medications that will decrease testosterone and decrease sex drive. So maybe what you're taking for your mono, or maybe that you're so fatigued from the mono that you don't have a sex drive. And I don't believe that. I have no studies, and I look in 9 journals every month, and for the last many years, I have no studies on mononucleosis affecting testosterone levels in young women, and you're young.
Yeah, at 33,
yeah.
Yes. Question from a Canadian viewer named Manon, and she wants to know, are there testosterone replacement options available in Canada?
Well, Canada has several compounding pharmacies that actually make testosterone pellets. A long time ago, we used to get them from Canada. But having said that, there's not anybody I can pinpoint, except I'm going to be training a physician, a female family practice physician from Vancouver, BC, in the next year. So and I would like to be training more doctors to do hormone replacement the way I do it, because it really does work. I mean, every day I have many patients that come in and say, this has changed my life. I am so much better, and they don't have the illnesses that they had before.
And actually, to go back to a question that we had responded to earlier, if you are looking for a hormone replacement practitioner near you and you're not able to find one, again, if you look in our book, there are some suggestions about how you can try to find one. But we have a website called BioBalance Health Affiliates, and your doctor can go to that website and converse with us about whether or not they would be interested in becoming trained by Kathy to become an affiliate to be able to do what she does in other regions around the country. So they can contact us directly. You can give them that information, and that may help you get what you're looking for. The next question that we have is from Rebecca, and she wants to know how you know for sure that there's a testosterone deficiency. Is there a blood test or what?
Or what?
Or what?
Initially, it's symptoms, and we do stress the symptoms and go over each one of them in detail in the book. But it's fatigue, it's loss of libido, it's loss of muscle mass, and let's see, what else? What else do people? Migraines and depression and anxiety. All of these things are things
Belly
that people
fat,
weight gain with in the belly. Sorry, I mean I'm more. You're remembering it better than I am. That's crazy.
I've had them all.
That's true, and so have I. So all of the testosterone symptoms, usually I have to have 3 of them to actually consider treating somebody, and then so I do that on a questionnaire, and then I do blood levels as well, and I look at the free testosterone in women. Free testosterone is the active form of testosterone, and it should be in young, healthy women. That's who we compare everybody to, not people our own age, but young, healthy women. It is between 7 and 10, depending on who you, which research you follow. But they are picograms per milliliter. So that's what you're looking for. So that if you're looking at your lab sheet, that's what your free testosterone level should be. It doesn't say that that's normal. They have a much lower level. That's why everybody doesn't think that they're low on testosterone. But they're comparing you to other people your own age, and everybody loses testosterone after 40. So.
Great. And we're getting quite a few questions from on air, and thank you for sending those. Anna wants to know, I don't know if it's the same Anna or a different Anna. She wants to know, do you accept patients from out of state?
Oh yeah, we accept patients from all over the world. We have patients.
People come in from Australia, Germany,
and
England,
London.
Yeah.
Yeah, we have people from all over the world, and for flight schedules and things like that, we try to make accommodations for those patients. So yes, we do. And
Blair wants to know, does supplementing with DHEA impact your hormone levels?
Well, that's interesting. There's DHEA is a hormone from the adrenal gland that is the precursor or the ingredient that goes to the ovary and then is made into testosterone. If you don't have ovaries, DHEA is not going to give you testosterone. The factory's closed, you're done. And the DHEA will probably make more estrone, which is belly fat and confusion and not being able to think, and will not do you much good. It can also make dihydrotestosterone, which gives you facial hair and hair loss. So DHEA in someone without ovaries is not helpful. DHEA in someone who has who's a female, who's low testosterone, who is younger than 40, can actually bump their testosterone production. They have to have ovaries. So that works for people who are a little younger. I like to use less than the 25 milligrams that's suggested by most people and break it in half or take less than that so that you don't get those other 2 hormones. But that does help testosterone production. In men, I think it's a good idea. If you're not already taking testosterone, then I think it's a good idea to take DHEA, and that does help you produce it, because men's testicles don't just go away or shrink or die when they get to a certain age. They just keep producing at some level testosterone.
Elaine wants to know if you should get off of antidepressant medications before you see a doctor for blood testing.
No. In fact, I don't recommend, until you feel better, going off antidepressants. If you really need antidepressants, you should stay on them until you get your blood tested and you're treated and you start feeling better. Because the last thing your doctor wants is for you to get really depressed. I mean, I've been depressed. It's not a pretty thing. And so I'd rather have somebody stay on their antidepressant for the first 4 months of treatment, and then and then we can go off as they feel better.
Well, and we write about this in our book. What we recommend is that you discuss that with both Kathy and your primary physician, whoever has prescribed your antidepressant for you. A lot of people find after they've been on testosterone replacement that they can come off of the antidepressant, but not everyone can. Not everyone's circumstances are the same, and we would advise you never to go off a medicine unilaterally without consulting with your physician.
Yeah, that's important. Very important.
Lorraine comes back with another question. She wants to know, can testosterone help by opposing estrogen as causing PMT?
Premenstrual.
Premenstrual tension.
I'm sorry.
Lorraine, we're not sure what
We're not sure what the
is
T
in
is.
England.
Yeah.
The usage. Some of the
Is it
spellings and
PMS?
terminology
I mean,
are a little different.
PMS is usually I use testosterone and progesterone to treat PMS. If that's what PMS is, premenstrual syndrome, and that is from a progesterone that is too low and an estrogen that is too high. So giving more progesterone balances it, and testosterone is a modulator, especially in the brain, and it modulates the neurotransmitters. So it doesn't take as much progesterone to get rid of the PMS. So I believe that's what that means. We spell estrogen differently too. So.
You have a question and an accolade from a former patient named Patricia. You delivered 3 of her children, and she loves you and puts her life in your hands, or has done so, and would not hesitate to do so again. She said, can she come and see you, or someone like her come and see you, without going through their primary care physician? She said her primary care is a male, and he just doesn't get it.
Oh yeah, nobody consults their primary physician. But I look at your Patricia. I look at your lab first and look at your symptoms and your history form, and it's kind of like a free consultation. I'll look at that before I'll ever ask you to come in. That saves you a visit in my office, coming in and talking to me first. Then we talk about what we know, hormone levels and how you feel and how we're going to fix it, and then we fix it right then. So yes, I'd love to see you again. And
Elaine writes, do you have names of doctors in Connecticut who are trained in hormone replacement therapy?
Send me your doctor. I don't have a Connecticut connection. There's a Dr. Lobo at Columbia. I mean, I realize New York is somewhat far away and a bad drive, of course, because of the traffic. But Columbia University, Dr. Lobo used to, when he was in Georgia, have a clinic that used testosterone pellets for both men and women. So he would be the closest person I have. But if you have an open-minded, like-minded physician who wants to be trained in this, usually it's internal medicine, family practice, OBGYN, are well-versed in the general hormones.
Background knowledge.
Yeah, or even ER. If you have a friend who's a physician who's looking for a challenging, it's almost as good as delivering babies. maybe it's better because I'm taking care of their moms now. So, but it's gratifying, and so it's a really wonderful practice. So, send me your doctors.
Okay. Pamela writes, what type of blood work would I ask for? I had a complete hysterectomy 4 weeks ago. All of the symptoms that you have listed and shared on the World Summit started when I turned 40. And she's talking about the World Summit for Hay House, who's the publisher for our book. Yeah. We did a participatory interview with them that apparently she has seen.
Which is awesome. Yes. That's great. So in general, there are a grouping of tests that I do. One is the hormones. We do estradiol, estrone, which is old lady estrogen, which we want to have that low. Testosterone total and testosterone free. Most of the time, I've now honed it down to just free testosterone for women. And so those are the hormones that came from your ovary. Then we have the hormones from the rest of your body, the cortisol level from your adrenal. We look at your prolactin level from your pituitary. We look at all of the other hormones that in terms of just testing to see if they're normal. Because if they're not normal, you're not going to feel better when I replace your testosterone and your estrogen. Then I look at other medical tests like a blood count and a metabolic panel to look at your liver and kidneys because they process hormones. Then I have to make sure your blood count's normal because there's many illnesses that can mimic the symptoms of low testosterone. So for somebody coming in, I need to know that you're healthy, and if you're not, how to fix this. And I need to know if you need to see another doctor first.
So this is not, what you do is not sort of mass produce, one size fits all, right. Give them a testosterone and let them go.
Right. That's not safe, and that's not healthy because you need to have the rest of your hormones balanced as well. So if your thyroid's off, and I check that, and oftentimes I find thyroids that are abnormal, I have to treat that because if I don't treat that, then you're not going to feel really great on your testosterone and estradiol. Right. So I have to treat them all.
Okay. We have an interesting question from Heather. She says, I'm currently getting pellets. When I get them in my left hip, I feel great and I have no side effects. When they're put in my right hip, my sex drive is non-existent. I don't lubricate like I should. I experience insomnia, and I start to put on weight in my belly. Is it possible that the location is an issue?
Yes. sometimes one side of the body has better blood flow than the other, or sometimes you've had surgery or injuries to the area. We use the upper outer part of the hip. So sometimes there's an injury in that area, or you've had scarring from surgery, or even just having pellets for a long time. So the short answer is always get them in the hip where you feel the absorption. Don't ever get them in the hip where you don't. That's just a waste. And I don't feel it's beneficial for people to keep going up and down and having hormone levels that are high or normal and then not normal and then normal and then not normal. So get them in the hip that has the best blood flow. The second answer is if there's scar tissue there from pellets or from, you've had pellets for a long time, then they have to use the trocar, believe it or not, and break up the scar tissue.
Right.
And sometimes we even have to use, a
form of local anesthetic.
Well, yeah, you have local anesthetic, you're not going to feel it, but
right.
Sorry, didn't mean to be scaring people. But we also can use a teeny tiny bit of a type of a steroid into that area if you're a scar former. That's a genetic thing. So I don't know why one side would be more than the other.
So absolutely you're not crazy if this is happening.
You're not crazy.
You recognize what's going on, and there are solutions that you need to discuss with your doctor.
Yep, we've seen everything 10 times.
So Patricia wants to know, once a woman goes on pellet treatments, can she expect to be on them for the rest of her life?
You don't have to be, but you can be. I mean, I have upper 80s, a man and a couple, they're both in their upper 80s, and you can be on testosterone as long as you like. And some women are able to be on, especially people with hysterectomies, are able to be on testosterone their whole life as well. They do very well on it. It keeps you from losing your muscle and losing bone and getting osteoporosis, and it helps your balance. Right. And so it keeps you, at least your body and your mind, healthy. It keeps your brain from shrinking.
Yeah.
And it delays dementia. So all of those things keep you out of a nursing home. So in my mind, if you do well on them, I'm never going off of them. I mean, you're never going off of them either, are you?
No, I don't think so. We had a question too about that in terms of older people who are getting pellets, maybe because of their life circumstances are not as interested in the libido portion. And so sometimes as they get older, they continue to get them, but the dosages have to change.
Yeah,
so it's another reason to stay in touch with your doctor.
Well, that's why you have to have individualized
right.
treatment. So yeah, the dose does go down if you're not interested in libido because you don't want to be tortured all the time.
Gina wants to know if HRT affects cysts in the breasts.
It depends on what type of HRT. It depends on how you take your estrogen. It depends on many other things. If you take an estrogen orally, you're making a lot of estrone. Estrone makes a lot of cysts in the breasts, and it usually causes painful breasts as well. So oral is not your best choice if you have breast cysts. In fact, oral is not your best choice anyway. So if you'd have to go to a patch, pill, pellet. Most people who are on pellets don't have as many breast cysts, especially if they have testosterone mixed with it. Testosterone does usually decrease cysts. Progesterone can also do that. And this is an interesting little fact that if you're iodine deficient, which also affects your thyroid, then you get more cysts in your breast. If you're in the Midwest, everybody's iodine deficient, so you should add iodine to your daily supplements. But iodine affects breast cysts, and nobody talks about that.
So is that different from fibrous breasts, or is that a
fibrocystic breast is what I'm assuming that this is that we're talking about.
Lorraine has come back with another question from England. She wants to know what you think is a good level of estradiol in the blood after total hysterectomy.
If you're taking, I can't ask you because you're not right here, but if you're taking estradiol, then a good level in the blood is a level that is between 60 and 250 and suppresses your FSH, which is the hormone that gives you hot flashes, below 23. So you have to look at both tests. You can't just say one number, because that is why it's so individual. Some women love estrogen. They feel great on estrogen, and they don't need that much. And they get a small dose and their FSH drops like a rock. And then some people need a lot to have that come down. But as long as your FSH is elevated, you're at risk for anxiety attacks and sleep disturbance. And you're also at risk of stimulation of your ovaries if you still have them. And we don't want that because that causes cysts even after menopause. So That's all I've got to say about
All
that.
right. Well, we'd like to remind you that this is your opportunity to ask Kathy a question directly. And if you look on the left-hand side of your screen at the top, you should see a button that has a QA on it. If you'll click on that, it'll open a panel that will allow you to type and send us a question directly, and we'll respond to those, as many of those as we can in time. And we also have a number of questions that we've received by advanced registrants to our webinar, and we're trying to work our way through all of those as well. The next question that we are going to address is one that we received in advance, and it's from Pamela, and she says, what type of blood work would I ask for? I had a complete hysterectomy 4 weeks ago. All the symptoms that you've listed and shared on the World Summit, we did this one already. Gina wants to know when should estrogen replacement be considered, which follows up on the same question that Lorraine just asked.
Well, but estrogen replacement should be something when you have symptoms, and the symptoms of estrogen deficiency are a dry vagina, painful intercourse, dry skin, hair loss in the very front of your head, and hot flashes. So those are loss of estrogen symptoms. So if you have those symptoms, then and you're probably right at menopause or in that interim period right before you stop having periods, then that's when you should consider it, and you should get blood levels to see if you are in menopause.
Anna wants to know if a severe case of mono can cause testosterone deficiency.
You know, I think she may have sent that in here, but that's not associated with it in any of my reading. I don't, unless you can send me an article that would educate me. I don't have any knowledge that mono is associated with testosterone deficiency.
And Kathy wants to know, how much testosterone would you give a man in pellets?
Okay, so men need 10 times as much testosterone as we do. Even though we make, when we're young, we make more testosterone than estrogen, men still need 10 times as much testosterone. So when we give pellets, we're giving, it usually works out to be about 10 milligrams a day, but we're trying to get 6 months out of the pellets for men, because we can give enough testosterone to them to carry them 6 months. We can't do that to us without major side effects.
But it still varies. It depends on their metabolism and their activity levels.
Right, it does.
And so they may stretch 6 months, they may go 5.
And their body size, their body mass. I mean, it depends on how tall they are or how wide they are. You know, more body mass means more testosterone. So when, but 10 milligrams is what I start, 10 milligrams a day, which means that we're doing 16 to 1800 milligrams in a pellet to carry 6 months. So that's where we start. We go up for the people that exercise all the time, the people who have fast metabolisms, or they tell me that they always had a really high testosterone level when they were young, lots of sex drive, lots of acne, things like that. So we go over all of that and then decide, we go up or down depending on activity level and body size as well.
Well, and even though you get blood tests to measure the levels of testosterone, those people who've been getting pellets will know when their testosterone is diminishing and they need to come back in, because different symptomology will surface.
Either you or your spouse will know.
Yeah.
Sometimes
my wife knows when it's time for
that she's the one that knows it in your house more than my husband doesn't pay attention to me.
She's the one that pays attention.
My husband just goes, oh yeah.
Well,
yeah, that's right. I guess that is true.
Okay, so we have a question from Chris in Torrance, California, which is good, because she asked, is there someone in the California area, especially Torrance, that provides these services? And the answer is yes, and she's an affiliate of Dr. Maupin, and she's on the website for affiliates if you want to go there and check other people.
Jen Park is her name, and she has Pasadena Pellets. I know Pasadena's not right there, but it's at least closer than Missouri. So, and she's
PasadenaPellets.com. You can find her there.
And she's very good. She uses the same methods as I do. We were just out there for a book signing. She had 100 patients show up. It was awesome. I mean, tons of happy people.
Yes. And Linda wants to know if you have a trained provider in the Seattle area.
Well, I'm hoping to get my British Columbia doctor, who's in Vancouver, Canada.
She's trying to get it set up.
Yeah, she's trying to get it set up. So I'm hoping to train her, but I don't have anyone currently who wants to be trained from Seattle. But it seems a good fit for Seattle too, because it's very
tend to be more open to new things
and kind of
but
on the edge of everything.
But take our book to your physician. Make them aware. Ask them to check our website.
We're trying to spread the word, and you're going to help us.
Hopefully. Sharon asks, I currently receive estrogen and testosterone pellets and a daily progesterone capsule. Is it better to take progesterone as a pellet?
That's a good question. Some people yes, some people no. And usually I start out with using a progesterone that's either under the tongue or in the cheek. They call it buccal delivery from a compounding pharmacy, or BLA progesterone from a specific pharmacy that is a pill, but it is dissolved not in your stomach but in your intestines. Anyway,
a couple of doctors we met in London use buccal.
Right. They use progesterone in the cheek. So I think that at first, when you're getting used to the estrogen and testosterone, you take the progesterone at night, and then you know exactly how you're supposed to feel. For convenience, then if people say, I can't remember it, or it doesn't make me feel great, then I will try the pellet progesterone. So that's a measure of how well you do on the buccal. If you're not doing it, if you can't remember it, then you need to have something else. The pellets are easy because you just have to come in every 4 months.
We have a really important question, and a fairly common question for you to receive, from Marty. She says, thank you for the wonderful information. Does any of this information change if someone has been through breast cancer treatments?
Yes, it does, or it can. It was when we first started doing this, it's 12 and a half years ago. Nobody wanted, all of my breast cancer doctors that I've worked with for years said, nope, no testosterone, no estrogen, no nothing. So now there's tons of articles that I've, of course, sent them. And now they realize that testosterone itself stimulates the immune system to fight cancer and every other abnormal cell in your body. So testosterone is a immune boost for people who have cancer. You want that. You want to be able to kill whatever cells show up with your T cells. It
strengthens your autoimmune systems.
It strengthens it, and it makes it more. If you have an autoimmune disease, that's a whole different thing. But it actually makes it not attack your own tissues. So testosterone is used in many ways. It's why we get these problems when we're over 40 and not when we were young and had the highest level of testosterone. It's that when we lose our testosterone, some of these things happen. But now they found, at least in the St. Louis area, they've been convinced that testosterone helps people who have had breast cancer and doesn't hurt people who have had breast cancer. Then the next question is estrogen. And most doctors, I ask the cancer doctors to advise me, and they say, usually no estrogen, but someday they may say yes, because they're not certain that it plays as much of a role in the development of cancer as they thought. I give vaginal estrogen so that my patients don't have painful intercourse and they don't have a dry vagina. So that doesn't get into the system, so their doctors are happy. So I try to comply with their cancer doctors. But testosterone is very safe and can be used instead of estrogen to stop hot flashes and make you feel more like yourself.
Well, and it matters, too, when your doctors know each other and trust each other. So Kathy's built a relationship here in St. Louis, but would be happy to build relationships elsewhere. We have another question from Linda. No, I'm sorry, I've read that one already. From Manon. Do women who have had fertility treatments, are they at a higher risk of having low testosterone?
There's not a study that I've read that has said that. I had fertility treatments. I took shots, but my issues are more about having my ovaries out than anything else. But many of the patients that I know who have had fertility treatments don't go into menopause early. They don't have a shortened span of life for their ovaries. So with that kind of, I never really thought about this, but with that kind of logic, I would assume from that their testosterone wouldn't go away early either. It doesn't change the timing of when testosterone goes away first, then progesterone, then estrogen. It doesn't delay menopause or make it any earlier. So I would have to say that I don't believe that has anything to do with it, but I don't have the backup with the studies. Everything else I've been telling you has all the research behind it, but I don't know on that.
Okay. Sharon says, I receive estrogen and testosterone pellets and take a 100 milligram capsule of progesterone daily. The progesterone causes diarrhea. What is the problem?
That's not a typical thing. I think I would change my progesterone type. I would change it to a buccal or even a pellet, because progesterone should not give you diarrhea. It has something to do with how it's interacting with the flora in your intestines.
Anna comes back with one more question. She says, sorry.
Got to meet Anna.
Sorry, it's me again. I have another question. After I was diagnosed with mono in 2012 at age 33, I became very sick. I'm now allergic to water and haven't had a period in the last 2 years, and I've had all of the symptoms of testosterone deficiency since then. Am I too young to have developed a hormone deficiency?
No, you're not. You could have there's I can't tie the mono together,
Yeah.
but it sounds like worse than mono, because mono is a limited illness. It's a disease that once you get your immune system back, then it fights the mono and the Epstein-Barr virus, and then it goes away, and then you feel better. But this sounds like something even more severe than that. I've never seen a case quite that severe, but it sounds like you went into premature menopause. And if that's the case, you can get some blood tests to find out. You can find, if your FSH is over 23 and your estradiol is low and you haven't had a period, then that's a premature menopause, whether the mono did it. And it sounds like something more than just mono.
We have a question from Alan in Orlando, in Central Florida. And actually, Kathy and I were just in Orlando. Kathy was asked to give a speech about what she does to the AMMG conference, which is
Age Management Medical Group, which is thousands of doctors throughout the world, actually.
And Alan's question is there somebody in the Orlando area that does this? And the answer is yes. We don't have direct connections to any of those. Several of them have indicated they are going to look into becoming affiliates of BioBalance Health, but we haven't gotten that established yet. But there should be providers in that area that you should be able to find.
Most of the doctors' backgrounds for men will be family practice and, believe it or not, OBGYN. Because when OBGYNs are trained to treat men with infertility, so that's hormones usually. So we're trained to do that, and so that's how we get into the hormone business. It has nothing to do with the baby thing. It has to do with the hormone issues.
As an OBGYN, treated women and began to do this with the women. They began to bring their husbands in, and so now about, 45% of your practice is male.
Yeah, it's growing.
Let's see what we have that somebody had sent in earlier. How does testosterone affect thyroid function? This is a question from Yona.
Well, thyroid function, it's very interesting. In men, it doesn't seem to affect their thyroid. I check before and after we do pellets, and it doesn't seem to make it worse or make it better or make it a slower thyroid or a poorly functioning thyroid or a hyperthyroid. So in most people, it doesn't have any, in most men, it doesn't have anything to do with the thyroid. They don't interplay. But in women, it tends, when I give them testosterone, it tends to make their TSH, which is the thyroid stimulating hormone, go up, and that means that their thyroid is getting a little slower. Now, that doesn't happen all the time, but I don't see it go the other way. I don't see their thyroids actually becoming faster or them putting out more thyroid hormones. So if anything, it can make your thyroid a little bit slower, not usually enough to put you into the hypothyroid state, but the tests just look a little bit like you're on the edge. I don't usually see symptoms from that unless somebody was already there when they came in.
Sandy says, my husband takes a testosterone injection regularly. Is this okay, or should he switch to a different type? I think it bulks him up too much and causes mood swings.
Okay, so what she's talking about is depo testosterone. I mean, I believe, so I'm making an assumption here.
Because it's a shot.
Assuming, because it's a shot, that it's depo testosterone. And that is testosterone with this little side chain, like chemically speaking, it's like putting like a little caboose on the testosterone to make it last longer, so it circulates through the body longer. But what happens is it's not really bioidentical, so it's not just like the testosterone he used to make. And this little cyprinate caboose actually causes him to make a lot more dihydrotestosterone, which bulks him up and can make somebody kind of angry and upset and irritable. And they make more estrogen, so they get more belly fat. So in some ways, I mean, pure testosterone in the pellets, it should get rid of belly fat. It should make you thin down and muscle up. But it shouldn't bulk you up too much. That's a dose-dependent thing, so I think the pellets would help him. But I also think that it may be dose-dependent, and he and his doctor will have to talk about that.
Okay, so we have the same question from two different places, one from Ecuador and one from London.
Whoa.
And the question is, will I go bald if I take testosterone pellets, or will I lose my hair? They're iterations.
Okay, so here's the deal. There's many things that can make your hair fall out. Anesthesia, that's one that nobody even thinks about. Oh yeah, I had anesthesia. Well, then it falls out for about 6 months and it starts growing back. There are autoimmune disorders that can make your hair fall out. No estrogen makes your hair fall out. Actually, no testosterone makes your hair fall out. Corticosteroids, like if you're taking corticosteroids for something, like a Medrol dose pack, that makes your hair fall out. There's a lot of things that can make your hair fall out. What testosterone can do, if it's not being watched, is if it makes a lot of DHT in women, you can lose some in the temples and the very top of your head.
Mm-hmm.
So when we have people complain of that, and that's their issue, then this is with the pellet therapy. Then we treat with something that's going to decrease the DHT, like saw palmetto or spironolactone in women. We don't give that to men, or finasteride. All three of those will decrease the dose of the dihydrotestosterone. Now, there are some other forms, like the we were talking about depotestosterone.
Mm-hmm.
Cyprinate is the actual testosterone. Cyprinate is the actual name.
Right.
It causes hair loss because it makes so much DHT in both men and women. So it depends on the type of testosterone, and the question was specifically whether testosterone pellets. And so to that question, I'd say no if your doctor knows what they're doing and they're watching your blood levels over the first 6 months, and then they can put you on maintenance and watch them once a year.
So a lot of this is the skill of the physician.
Just knowing and caring enough to want to not have these side effects happen to the patients. I had one physician at the conference, who will remain nameless, who came up to me and put her hands on her hips. She says, "I never get any side effects from those hormones that I give. I give creams, and I only give creams. I never get side effects." Well, that just means you never had a side effect. You've never given enough. So no one's really better. But of course, they wouldn't have side effects because they're not getting rid of the symptoms either. So it's, we deal with side effects and then we counter them, and knowing how to counter them is the key.
Linda writes and says, "I had a hysterectomy, bilateral oophorectomy, 4 years ago, and have not had any HRT since. Your book stated that I would not need progesterone in my treatment. A local doctor had wanted to include progesterone with the estrogen and testosterone to protect my breast tissues. What are your thoughts?"
Well, there is a theory that progesterone balances the estrogen for the breasts, but progesterone also has a lot of side effects, and in most of my patients, they don't feel good on progesterone.
Mm-hmm.
So, having said that, if you've had a hysterectomy, I do very well with patients with breast tissue with testosterone. Testosterone protects your breasts. I don't really need the progesterone.
Uh-huh.
So my answer to that is it's his opinion that he wants to give you progesterone, and that's his method. My method is different. We have differing opinions. It doesn't mean that one's completely right and one's completely wrong. It just means that the way I do this is I don't give progesterone to people who don't have a uterus unless there's something else going on. Like, there's a small percentage of progesterone people who get irritable without it. So those people, yeah, it's kind of like having PMS all the time. I'll give a little progesterone to, but even if they don't have a uterus. Otherwise, I don't believe that it's a necessary hormone.
So it is a matter of opinion, and perhaps if you have this question, you should talk to your doctor and say, just explain it to me more so that my anxieties are lessened. Mm-hmm. What is your reasoning? What's your thought process?
The type of testosterone is used.
And not as a challenge, just to say, I really want to know, and as an intelligent consumer, you have a right to know. Mm-hmm. Alan has written a 3-part question. I have a pituitary adenoma, mm-hmm. and I am on 100 milligrams of testosterone cyprinate injections weekly. My levels are 350 to 400 on the injections. What should my levels be? Would depotestosterone be better than cyprinate, or should I try pellets?
Depotestosterone is cyprinate. Mm-hmm. And because of the side effects of the depotestosterone, he's keeping your levels low. No male feels really good under the level of 400, and the free testosterone should be over 129. So once you hit 129 on free testosterone and 400, then you might feel good. It's not everybody. Some people feel well on that level alone. But if you don't feel well, then you need to have a higher dose. And having...
You're also going to cycle quicker on the injections.
Well, he has to do it once a week.
Yeah.
So he needs a higher dose once a week, and hopefully his symptoms will go away with a higher dose. Or he could change the pellets and then get a dose that can bring him. I mean, we've brought people up to 1,200 I mean, it depends on what your body needs. And your body used to have a certain level of testosterone, and you can kind of tell that about basically by looking at guys and kind of, look in the mirror and, how craggy is your face. If your face has nice smooth lines, usually that's not when you were growing up and had your testosterone at its peak. It wasn't really a lot of testosterone, but people who have more angular features or are bigger guys, bulkier guys when they were young, need more. So you may need more. I'd say if your symptoms aren't better, if you're not sexually functional and you don't have if you're fatigued, if you have depression, then you need to increase your dose.
Manon writes, question, is low testosterone more likely to occur if you've had thyroid cancer?
Not just because of the thyroid cancer. It depends on what they treated your thyroid cancer with, and you may have the symptoms may be more severe if you've had thyroid cancer and your thyroid's not working. So you may feel the symptoms more acutely.
I'd like to remind you that we have about 10 minutes left. If you want to get a question in, you need to submit it, and if we don't get to it, if you would attach your email address to it, we'll respond to you directly. We won't share those with other people, but we'll see that you get an answer to your question. Also, we would like to encourage you, for answers to your questions, get a copy of our book, The Secret Female Hormone. Read that. Many of the questions that we've been addressing today in this webinar have also been addressed in the book. So for more comprehensive answers, you can check there. We would also encourage you, if you live in an area where you don't know physicians who do these things, take our book and share it with your physician and ask them to look at biobalancehealthaffiliates.com, which is a website that Kathy has set up to talk about her training program with other physicians so that they can learn what she is doing here today. One of Kathy's strongest specialties is her ability to troubleshoot and problem solve, because she's been doing this so long. And when she was talking to the other doctors in Orlando, they were following her around in a little horde with questions because they don't know these things. And that's why she wants to talk to them.
Yeah.
And the video of this also will be available later. So if you didn't absorb everything that you wanted to absorb, you'll be able to chance to play it back later and go over it in more detail.
Could you go over 16?
I will look and see.
It's about fibromyalgia.
All right. Question from Alba. Alba says, I discovered your podcast while looking for something new to treat my fibromyalgia. I do not live close enough to be able to see you as often as needed. I did find a doctor within 2 hours of me that was familiar with you and your treatments. My question is, I'm only getting approximately 2 to 2.5 months instead of 3 or 4 months. I've been doing the treatment for about 15 months. Can you advise what would be best to help make the testosterone last longer? I love the treatment, and I can feel when the level is getting low, and I need another implant.
Fibromyalgia is treated very well with testosterone pellets. However, testosterone has to be, the dose for patients with fibromyalgia has to be increased over what you would give anybody else. Fibromyalgia is an autoimmune disease. It attacks your muscles and causes a lot of pain in many areas. And to cause the immune system to get back into its normal function, you need a lot more testosterone than usual. So I sometimes have to treat women with 250 to 300 milligrams to get them the full 4 months, because that's what it requires to keep them from feeling like they have fibromyalgia. And that goes for rheumatoid arthritis, MS, many of the other, I have Sjogren's disease and lupus, and that's it. So those are the types of autoimmune disorders that I've already treated with testosterone. They all need more than the average person, which would be like 175 to 200 milligrams of testosterone. So I would suggest a higher dose because of the problem that you have, and I would suggest that trying to get it spaced out to 4 months would be much more comfortable and much more, of course, affordable too.
Since her doctor is familiar with you and your work, if he wanted or she wanted to contact you about that, because some of them are anxious about the dosage levels. They're not confident.
Yeah. I've been doing this so long with so many thousands of patients that when someone doesn't feel better, but they should feel better, but their blood level is rather high, everybody gets a little worried. But what's testosterone going to do to a female?
Yeah.
I mean, really, if we've got their hair covered with using spironolactone, you know,
Well, but you do get
facial
questions
hair.
about, will it make me more manly? Will I bulk up? Will I grow facial hair?
And yeah, you'll get
Will
more
my
muscle.
voice drop?
That's a dose dependent thing, and then singers. A singer with fibromyalgia would be a problem, because I would not want to give her too much testosterone because of her voice, but I would have to give her more if she wanted her fibromyalgia to actually be treated. So sometimes you have quandaries like that you have to figure out and ask the patient and say, what do you want?
Penny writes and says, is it normal that my sex drive still fluctuates and is even non-existent at times when I'm taking pellet injections?
That's kind of like
the question we had
the
before.
question that we had, where one hip absorbed and the other hip didn't.
Yes.
So so it may be that it may be where the pellets are inserted, or if there's scar tissue, or if you're developing scar tissue around them, it blocks them from the blood supply. So we usually have people massage them or sit in front of it once they're healed, which is like a week. Sit in front of the jet on their hot tub, or on their jets in their bathtub, so that they can get blood flow and break up some of the scar tissue. So in that way, I think it's not really normal, but we have seen it, and that's how we deal with it.
And you want to discuss that reality with your physician.
Yeah.
Nancy writes, why is complete hormone replacement so expensive such that it is only accessible to the rich?
Well, you can thank your taxpayer dollars for paying the FDA to not approve bioidentical hormones in any type. So we, the taxpayer, 50% of the population is female, and so they don't approve bioidentical hormones for women, and certainly not testosterone. So because they don't approve it, insurance doesn't pay for it. Because insurance doesn't pay for it, then when the doctors like me are doing it, if we can't do it for free and insurance won't pay for it, you have to pay your staff and you have to pay for what you're doing. So the actual cost may seem like it's every 4 months for women. It's between, in some areas, it's $450, some areas $550. That's the average cost every 4 months. But most of the time, you can drop many of your expensive medications and the highest copay medications if you have to pay for those. So oftentimes people don't have to take their diabetes medication. They get better. They lose weight. Their high blood pressure. People go off high blood pressure medication when their blood pressure comes down and when their cholesterol comes down. So they save the money on that end. But how do you put a price on avoiding Alzheimer's, dementia, osteoporosis,
right,
and sarcopenia, where you have to use a walker or a wheelchair?
And one other way to look at this question too is, how many medicines can you come off of that you or your insurance company are already paying for? So it may be self-affording if it corrects enough of what's going on in your life.
But the reason?
Yeah, but the reason
is the FDA and insurance companies.
Your taxpayer dollars at work.
Yes.
So Natasha writes from France, how can I get bioidentical hormones in France?
There is a wonderful age management doctor named Thierry, Thierry, Hertog, Hertogue. He's an endocrinologist, but he does anti-aging treatment, and he does all kinds of different types of testosterone. There's a lot more available in France than there is in the United States. So he is the best. And I think, I'm not exactly sure where in France. You may want to Google him. But he comes here and does lectures for all the American doctors, and he's awesome. So he would be a good source if there's not someone near you. He may have somebody he's trained near you.
So it's awesome that we're getting questions from France.
Yeah,
and England,
I love this. I feel like I've traveled.
All over the United States.
I'm going to have jet lag.
Vicky writes, I had radioactive iodine treatments for Graves' disease, and now I'm being treated with levothyroxine
Yes.
for hypothyroidism. I suffer from anxiety, fatigue, etc. How can BioBalance help me?
Well, radioactive iodine is a treatment it just burns out your thyroid, basically. And your thyroid is the gland that keeps your metabolism going, keeps you from being tired. I mean, testosterone helps you from keeps you from being tired too, but the thyroid actually is your furnace. It burns calories. If you don't have enough thyroid, then nothing in your body works. Your enzyme systems don't work because you're cooler than you should be. One way to document that you're low on thyroid, even on your levothyroxine, is to take your basal body temperature. For a woman who is menopausal or not menopausal, your temperature before you get out of bed in the morning, oral temperature, should be above 97.9. So either 97.9 or more. If you're not that when you get out of bed, then you most likely have either too low a dose or you have the wrong thyroid. And what I would do, most of my patients get Armour Thyroid, and that is because it's just more effective in women. And it's an oral tablet. It's made from pig thyroid, and the statement "people are pigs" we use a lot of things from pigs for humans, for grafting and things like that. So their thyroid is very similar to ours. So we use pig thyroid, and it actually works. It's been around forever, and it works better for women. So I have a lot of women on that. I have some men on that. It's about 50-50 for men.
Yeah.
Right? But levothyroxine doesn't work for everybody. And so you have to find something not that just makes your blood levels look good, because levothyroxine can make your blood level look good, but if it's not making your temperature come up, it's not really getting to your to your receptors and for thyroid, and it's not really doing anything for you.
A question from Renee. I am a breast cancer survivor. Am I able to use hormone replacement therapy?
That we started to answer some of that. We answered a little bit of it, but I would give breast cancer survivors testosterone, and usually if they were on tamoxifen, which I find to be have so many side effects that I'm not positive I would take it. I would take the alternative, which is Arimidex. Arimidex also fights breast cancer, but the way it does it is it keeps patients from making estrone, which is the old lady estrogen that makes them feel terrible. So they've done lots of studies with pellets of testosterone and Arimidex, and they found that the group that took that combination versus the women who took tamoxifen and nothing else, the ones that took tamoxifen had a normal rate of recurrence, and the ones that took testosterone pellets and Arimidex had no recurrences over 5 years.
So thank you very much for your questions today. This has been the first of the BioBalance webinars, and we appreciate your participation. You will be able to see this again later online should you choose to do so. You can contact us directly at biobalancehealth.com, drkathymaupin.com, thesecretfemalehormone.com. You can follow us on our podcast. We have a weekly medical podcast that's available on iTunes and YouTube, or you can find the links to those on our websites. Thank you very much.
Thanks for signing in and signing up.